To separate fear from fact, I sat down with two infectious disease experts in Hong Kong. The coronavirus is man-made.
If you look at the virus itself, if you look at the phylogenetic tree, we find that basically the virus pops very nicely in between the Bats coronaviruses and the SARS coronaviruses. So we believe that this is actually a natural evolutions of this novel coronaviruses.
So it didn't come from a lab in China. This wasn't bioengineered.
Unlikely.
Since the outbreak began, there has been a wave of misinformation prompting this open letter by scientists in The Lancet. Conspiracy theories do nothing but create fear, rumors, and prejudice that jeopardize our global collaboration in the fight against this virus. My pet can give me the virus because we know that a pet here in Hong Kong has tested positive for the new coronavirus. The pet has even been placed in quarantine.
It's very unlikely and more likely that dog has been environmentally contaminated.
Even though if it's contaminated, you won't get a very high viral load. And it's very unlikely that you can actually be transmitted from the pets to you. It's very unlikely.
Now, this is a big one. Wearing a mask will not protect me from the virus because you have the US Surgeon General telling people you don't need to buy a mask. It's not effective. Is it?
If you look at the data in Hong Kong, wearing masks is probably the most important thing in terms of infection control.
Wow.
It not only brings down the cases of coronaviruses, it also brings down the influenza. In fact, this is now the influenza season, and we hardly see any influenza cases. And that is because the masks actually protect not only against the coronaviruses, but also against the influenza viruses as well.
The coronavirus is less deadly than the flu. How did they compare?
If you look at the 1,000 cases being reported by Professor Zhong Nanshan in New England Journal of Medicine, basically the mortality rate is around 1.4%, or probably even going to go lower is the denominator getting bigger. So it still stands at about 1%. For influenza, it's 0.1% or even lower, depending on what seasons you are. So it's still 10 times more deadly compared to influenza.
The virus will go away in April. We've heard that from many people. We've heard it from US President Donald Trump.
Yes,
Is that to be believed?
It's very speculative, right? I see people partly say that because SARS kind of went away in April, May, but when it's warm here, it's going to be cold somewhere else. We've got a southern hemisphere too.
In SARS, it only affected a few countries, but this time is really a pandemic scale. So basically, it can come back, especially in the southern hemisphere, and then alternate with the northern hemisphere.